Addiction is more common than you would think. Alcohol and illicit substance use are the leading cause of death in the world. And about 95% of people will experiment with these substances during their lifetime.
My oldest son, Conrad, who also was bipolar, ended up with a substance use disorder. In 2015, he lost his battle with that disease. We took him to treatment, we mortgaged our home and our finances, and unfortunately, he died while we were still duking it out with the insurance company and Department of Corrections.
My name is Lana, and I have lived experience, many decades struggling with addiction and substance use disorder. I tried to control things, and I know how serious it was, but there was no stopping. I also know what it's like to be treated by health professionals as if we're hopeless and we're not going to change and we're very, very dirty.
The word stigma is to be branded, to be marked or disfigured. It's a very uncomfortable feeling.
Basically, it's a body language and it's very loud. The nurse was in the room as I'm changing, and you could feel her emotions. You could feel her disgust, and it was just unbelievable to be treated like that.
A lot of patients don't want to hear that. They don't want to be disrespected and ridiculed. They don't want to feel that sense of rejection. And so they don't seek care. They just try to take care of things on their own.
I would say that most of my experiences trying to get my son help, even in the mental health field, was pretty dismissive. And so the message to me was that my own flesh and blood was not worth saving.
It validates the fact that I am not worth anything, and there is no hope.
Addiction is a disease, not a flawed character or lack of moral virtue. It's just as easy to discriminate against somebody as it is to tie our shoes. So in order to not exhibit that prejudice, it takes a conscious effort.
I will make it perfectly clear my son was difficult. But you see, the difference is that they had him for a moment. My husband and my son and I had him 24/7. So the help that they could have given us in those moments, even though I understand he was difficult, could have also saved our family. All that heartache.
You can make a difference in how you talk, how your facial expressions are, in having someone influenced in their recovery, either success or failure.
Many providers, when they encounter a person with a substance use disorder, they think that it's hopeless and it's up to the patient to change. They don't realize that the patient has a medical illness. Connecting with that person and trying to get down a few layers to what the problem is, that helps to unmask a lot of problems. I see patients that go back to their families, they go back to work, they reconnect, and they mend those relationships.
I have found that the world of recovery is a lot of fun, and it's really awesome to be a part of and feel worthy of being a part of.